Okay, this is Rory. Rory, why don't you tell us what problem you have and how did you find me?
Yeah, my name is Rory Roybal. I have a very serious neurological autoimmune disease which has been diagnosed successively, initially misdiagnosed as Guillain-Barré syndrome, then transverse myelitis, and now an even more than 1 in a million disease called Devick's disease.
Forget about the diagnosis. Okay,
Yeah, okay.
Tell us what exactly the diagnosis means nothing. Okay, yeah. As I told you, yeah. Huh?
What would you like me to tell about?
Like what kind of, you have spinal degeneration. You got holes in your spinal cord.
That's correct. I have a hole in my spinal cord.
What happened? How long ago was that?
July 2012. I initially contracted this disease.
2 months before then, they say you were completely healthy.
3 months I had a full physical, and I was told I was completely healthy and had the body of someone in their 20s.
Okay, so that means that they really don't know much about the physical exam doesn't mean anything, because you are not healthy. You're just on the verge of a really serious disease. They cannot detect that.
They could not detect it, and they have no cure for these diseases. They only try to slow them down, but they don't have any cure, and they don't know the causes.
Just 1 second. They say they try to slow it down. Did they slow down the disease for you?
No, no, they did not.
Okay,
I've been degenerating, although sometimes more than others, for approximately 2 years.
Yeah. So actually, you've been degenerating. How much how much worse now than you were initially?
Oh, I would say 40, 50 times worse.
Yeah, you see? So all the things they say, I will slow it down. How? With drugs?
Yeah.
You cannot slow down anything. You know, slow down your disorder means that you have to restore your order, restore your health.
Mm-hmm.
They don't know how to restore your health.
Yes, they have said that. They don't know how to restore my health.
So how are they going to slow it down? If they cannot improve your health, how are they going to slow down? It's just talk.
Yeah, that's what they claim, but it has not been true for my case for over 2 years. I even told my doctor, from my perspective, Western medicine has done nothing to get me better.
You got your words. Okay, what did they treat you with?
They treated me with pain medication, which is a symptom, and they treated me with things for muscle spasms, which is also a symptom. Other than that, they basically give me physical occupational therapy and hope the body heals itself. They do not know how to heal it.
So how about the physical therapy and occupational therapy? How much did that help?
I think it helps to not make me worse, but overall, obviously, it has not made me better.
Mm-hmm. Okay, so how much medication you're taking?
Right now, I'm taking a whole boatload of medication for pain and muscle spasms and urinary issues and bowel issues.
Mm. Okay, so how did you find out about me?
I found out about you, initially from my friends. They're both my friends, my friend and but primarily his wife, and also from my older daughter. And I also found out directly from you by you contacting me on my website and being kind enough to follow up and talk with me on the phone.
Yeah, basically I contacted you because
Yes.
I saw you in the Christian newspaper. You put an ad out for asking for help, and you have a website describing what happened to you. You wrote a very detailed history. So I wrote an article which I'm going to post on my website. I wrote an article explaining to you, okay, you're not going to get any better with Western medicine. In fact, you're going to get worse. With more medication, you're going to harm your liver, harm your kidney. The kidney control the circulation to your spinal cord and to your brain. So the kidney control the marrows. When you get problem with circulation to your spinal cord degenerate. In fact, everything is circulation. So today, I open up circulation to this is your first treatment today.
Yes.
Okay, and I help to get you out. We have taped that already. So tell us how much pain you had before and how much less pain you now or improvement since I gave you the first treatment.
Yes, some of the pain, the worst pain I experience are in the bottom of my feet, my core, and my arms, including my right shoulder has a rotator tear. I don't have much sensation, sometimes no sensation in my lower body other than pain on the bottom of my feet. My pain is less. It's not gone, but it feels less. My forearms feel quite a bit better. Overall, I feel more relaxed. It's hard to describe. It's more like I'm not just relaxed from an external standpoint. I feel more peaceful from an internal standpoint.
Exactly.
It's very hard to describe that, but that's what I feel.
Okay. The reason why you feel that, I told you, human is a body and spirit. The living part is a spirit. I put you as a spirit back to the body. Not totally. You got too many blockages. It's not easy for me to get everything. Otherwise, it would be way too sore. I give you 100 injections. I cannot do that. And on top of that, I did not have very easy access to your body because you were sitting on chair. I cannot get to your bottom, the back of your leg, and so forth. Okay, but in spite of that, your leg better. But your arm, how about your arm? How much pain you have in your arm? See how much better you move?
Yeah, my arms, I can, generally they're in pain even when they're not moving, and more pain when they are. So I feel a lot. I feel pretty much no pain. I can make myself have pain by twisting a lot, but the pain seems to be, gone in a stationary position, and I feel like I can be more mobile as a result of not having as much pain.
More control, more flexible.
Yes.
More control by you.
Yeah, that's true.
Yeah. Okay, great. So you try not to miss. You come back next week.
Right.
Okay, and then the next treatment going to be even better because if you don't delay too much, I don't have to inject as much, and then more blockage are clear. The healing will be better.
Okay.
Okay. Good.
Sounds good.
Thank you.
Thank you, Dr. Tom.